What's up, everybody? I'm Katie.
And I'm Morgan.
And this is For Your Misinformation, a podcast dedicated to empowering women to become more politically engaged so we can act in our own best interest.
Let us identify the problem and tell you what we're doing and what you can do to help solve it.
Hi, everybody. It's Katie, and I am here today with my friend Andrea, who is a nurse at a Chicago hospital. Hi, Andrea. How are you doing today?
Hi, I'm good. How are you?
I'm good. How's your weekend been? We're recording this on March 29th, Sunday in the afternoon.
Yeah, it's been good. I've stayed home, but I've enjoyed it. Actually, I went for like a good hour-long walk yesterday.
Oh, nice.
Which was, yeah, it was very nice.
Good. Okay, well, before we start, do you want to tell people how we met, how we know each other?
I do. We definitely met swimming when we were very young.
Yeah.
Like somewhere probably between like 6 and 8 years old.
Yeah.
But my like oldest memory, I guess, which I'm sure you remember, is when I accidentally kicked a soccer ball and gave you a bloody nose, and it still haunts me. And I'm still sorry.
If you didn't bring that up, I was going to. I have never held it against you. We were like, I'm sure we were at swim practice, like at our high school, but before we were in high school, just like playing soccer as like conditioning or whatever before we got in the pool. And yeah, I mean, you played soccer, so you had like a strong ass kick, and I took a soccer ball straight to the face and had like easily the worst bloody nose I've ever had in my whole life.
I'm so sorry.
That's all right. No, that's funny. 'Cause that's my first memory of like us together too. But there are a ton of very positive ones after that. I mean, like, we swam in high school together. We swam in college together. We have been roommates at different points in time. Like, there's lots of very nice memories also.
Do you remember swimming in college with clothes on? Like, I don't remember. We swim with clothes and shoes on for some reason, and I did some like stupid breaststroke kick and accidentally kicked you in the face again.
That was you?
Yeah.
I don't think that was you. I remember getting kicked in the face. Why?
No, I think I accidentally did. We weren't even in the same lane, right? It was just like
So I have a distinct memory of like swimming with clothes on, like for drag or whatever. Shoes were easily the worst, but I do remember somebody like in front of me doing a breaststroke kick and like taking it like to the jaw, basically.
Oh God!
It didn't really. I mean, I don't know. It hurt a little bit. Okay, maybe it was you. I'm pretty sure it was a different kid on our team.
Oh, hold on. Let's blame someone else. That's
okay.
Fine. Like my memories, we all know, are not the best. So.
Let's blame it on Shane, because that's who I've always blamed it on.
Are you listening, Shane?
Yeah. Why aren't you, if not?
Also, why did you kick Katie?
Yeah, like I didn't deserve it. I do remember like getting out and coach like looking at my face and being like, yeah, I think it is like a little lopsided. And I was like, I don't think it is. I think that's just what my face looks like. Like, let's just like move on. But it's, I don't know. It all worked out.
Oh, man.
So yeah, yay. We've been friends for a really long time. And when we lived together, you were in nursing school, right?
Mm-hmm.
Yeah.
I was. Yep.
And now we both live in Chicago, and you are a nurse up here.
Yeah.
So what kind of, what?
I said yes, accurate.
Accurate. So what kind of like a setting do you usually work in?
So currently, so I started at like an inpatient floor that took a lot of traumas and post-surgery patients. And then I moved to a float pool. And then, so I would see like a little bit of everything. And then a little over a year ago, I went to an outpatient office. So we see patients who may or may not need surgery for their condition.
Mm-hmm.
And then if they do, I work with them to get them scheduled for surgery. And then I see them post-surgery too. So it's very elective surgery focused.
Okay. So is it like it's more chill than your other positions?
It is. Patients are not acutely ill when they come into the office.
Okay.
So it's very different, and we don't take care of them in like the immediate post-surgery phase. While they're hospitalized,
It's like
that's
follow-ups.
a different team. Yeah, we do follow-ups, like removing staples, and then just like any questions they have once they get home.
Mm-hmm. Okay, cool. So how has that like setting changed since like coronavirus has become an issue, particularly in Chicago?
Yeah. So initially we tried to reschedule anybody that we could to a phone call, so that they could stay home, so they're not being exposed, so we're not being exposed. So not everything, but most things were transitioned to phone calls with the doctor. And then as of Friday we went through the training for video appointments, or like telehealth. And then that should go into effect Monday. So like they use Zoom actually. So the program uses Zoom, and then you can video chat with your provider.
Okay.
And that's our goal for the next couple months.
Okay, that sounds good. That sounds safe.
Yeah.
So when you and your coworkers are talking about like what's going on now and what's going to happen in the next couple weeks, like what do you guys talk about? What do you think is it going to look like in the next couple weeks here in Chicago?
Okay. So the hospital that we're affiliated with does have I guess it's like an overflow tent or a surge tent.
That's good.
I think they call it. So that's set up to keep suspected COVID patients separate from the ER, I think they call them PUIs, person under investigation, I think is what it's called.
I've never heard that before.
Yeah, I don't know if that's used universally.
Learning something new.
Yeah. So they do have a separate tent for that, and that is not, like, they don't have the staff for that. So we're expecting to be asked to work either in that tent, or right now they're checking everybody's temperature on their way in and out of any building that you work in, any medical facility, outpatient or inpatient. So if your temperature is above 100.0, you get sent home, and then employee health will call you and give you instructions on like what to do, if you can come in, if you're going to monitor, stay home for 14 days.
Didn't that just happen to you?
That my temperature was high?
Or you were sick. You weren't going to work.
I was sick. Yeah, I was very sick. Towards like kind of the beginning of all the outbreak, I guess. I was very sick, and I did stay home from work for 4 work days, but 6 days total, because there was a weekend in there, with fevers every day.
Yeah.
But,
you were like knocked on your ass, really. Like,
yeah.
Sorry to use the medical terminology, but like you were like, it was rough, right? Like, I don't know. It
was the worst illness that I have any memory of. But my respiratory tract was fine. So I don't know if COVID is only called COVID because the only reason they test is because you develop respiratory symptoms. So like, did I have a mild case? Maybe. But we'll never know because they couldn't test at the time.
Yeah.
But I was the sickest I have any memory of.
Yeah.
Being.
I mean, maybe like in a year we'll be able to test for antibodies, but yeah, like until then it's like, who knows? But
yeah, because if you have a sore throat, fever, body aches, if you have everything but difficulty breathing, no one we care, but the treatment is to stay home.
Right.
So,
you're not in like imminent danger of not being able to breathe.
Yeah, exactly. Yeah. So, and I'm okay with that. Like, there was no reason to test or wait to test because they were very short at that time. But yeah, I was very sick.
The other thing that I meant to ask you was you live with your boyfriend who's a doctor at the same hospital that you work at, and but he didn't get sick, right?
He didn't. Yeah, which was one of the reasons.
That's interesting too.
Yeah, which is why I didn't think it was COVID-19. No one I work with got sick, and then Phil didn't get sick. So,
Mystery.
hopefully it wasn't, but
but if it was, then you're immune.
Like, if it was, I'm potentially immune, and that would be really good to know.
Yeah. But yeah, who knows? Okay, so you think that once other hospitals kind of get overwhelmed, you and some of your coworkers will probably be asked to like assist there, right?
Yeah.
Wherever you're needed.
I think inevitably the staff is also going to get sick everywhere. We know how this spreads. I think it's inevitable. So I think we are kind of like the second round of
your backup
employees. Yeah, kind of like a backup. So I think they would first, like employee health needs help because they need to direct employees that are getting sick or feeling ill. I think this tent that's being set up is going to need assistance.
Yeah.
And then actually, if the hospital is at capacity and they still have people who need assistance, those people will be sent to the clinics in some fashion for something. We don't know what yet because we're not set up to give oxygen or to do any acute care. We're not really set up for that. So it'll be interesting, but I think it's part of the plan.
Okay. Well, that's good.
Yeah. I think there's things in discussion, but luckily that's not needed yet.
Yeah. So how are you feeling about all of that?
With all that being said, I do feel like a little bit helpless because I'm not helping fix anything.
Yeah.
Something we talked about at work is like there's no definitive role for anybody right now. So no one knows, like, can you just tell me that every day my job is to answer phone calls that come into the hotline? Fine, I can do that. Or tell me that my job every day is to go to the tent and help there. But we don't have that yet. So we're just kind of waiting to be directed. Yeah. So I feel helpless. But at the same time, I don't think they need my help yet, which is great.
Yeah. I didn't really think about, like, until we started talking about it, that, like, yeah, of course there are nurses who aren't in, like, hospital settings, like acute care settings, who are less likely to get sick. So, like, there is a kind of like a second wave, a backup wave that can work. I mean, it's complicated because you said, like, there's some, like, HR hangups and stuff, but, like, at least people are talking about it.
Yeah, and it changes every single day. So we had talked about this a couple of days ago, and it sounded like logistically it was more difficult than it should be to like give aid to other places. Well,
like they're having like retired doctors and nurses come out. Like, why can't they figure out how to get you where they need you to be? Yeah.
So apparently, like, updated on Friday, that's not a thing anymore.
Oh, okay.
So yeah. It sounds like this week there are some places that need help, and I have volunteered, so I might be.
I didn't know that. Good for you.
Moved somewhere else. Yeah. What I was told is that it would be probably employee health assistance to start. So.
Gotcha.
We'll see. Yeah.
We also, like, despite being friends for a really long time, have like a weird commonality in that our moms have the same illness, which is kind of rare. But both of our moms had breast cancer that has now metastasized to the bone, right? Isn't that the case with your mom too? Yeah. So, you were the very first person that, like, once I realized how fucking serious this whole thing was, like, you were the very first person that I reached out to, because I was like, because I was really worried about my mom, and I was like, oh, Andrea's mom is in the same boat as mine is. Like, I want to reach out and make sure that you are on the same page I was, and that, like, your mom understood the severity of, like, what we were dealing with too. Do you remember that?
Yeah.
Yeah,
I do.
It was scary.
Yeah. Um, yeah, my mom's very like independent, and she likes to be very busy.
Yeah.
So I think it's been hard to deal with the fact that you can't do what you're used to.
Yeah. Well,
Um,
she's like an elementary school sub, right? Or a teacher or sub?
yes. So she retired last June at the
Mm-hmm.
end of last school year, and then she was subbing in for somebody's maternity leave.
Mm-hmm.
Which when all those schools were closing down, her school was one of the last closed down.
Yeah. I
Like,
remember you were like, she's still planning to go into work on Monday. And I was like,
yeah,
no,
yeah,
absolutely not. Like those children are petri dishes.
yes. Thank God. I think I'm going to pull up a calendar, but I think that was 2 weeks ago
Yeah.
this Tuesday. Yeah. So
Good.
I think fingers crossed we're okay.
That was scary.
Yeah. And I think it's like hard to, for anybody, I think it's hard to imagine what's happening inside your body because
Mm-hmm.
you can't see it and you can't always feel it. So it's hard to remember, like, oh, hey, I don't have an immune system. If a kid sneezes on me, I might get sick. I'm not just going to fight it off and
Right.
have like white blood cells.
Right.
But you can't see that. So it's hard to think about.
Yeah. But she's doing good, right? Like
She is.
medically,
Yeah.
she's doing good.
Yeah, she is.
Good.
Yeah. She's staying home. She jokes that like I'm her mom now.
Yeah.
Like I'm her mother figure. I'm like, stay home. I'll bring you whatever you need.
Yeah, exactly. That I feel like we've been like video chatting with our friends a little bit, but like it seems like everybody is like that. Like everybody's trying to get their parents to like take this fucking seriously.
Yeah.
It's weird. I mean, yeah, parenting seems hard. And now I understand sort of a little bit.
Yeah. The millennials are, as I saw it worded better by someone else, but the millennials are at home yelling at their parents to stay home.
Yep. Yeah. Like, don't go to church. Actually, my grandma and aunt, my stepdad's mom and sister came over. Me and my mom both just had birthdays. And like they made a sign that said like happy birthdays, and they like dropped off some stuff that was very sweet, but like stayed far away. It was really nice, but like as they were getting back in the car, I was like, hey, you're not going to church, right? Like, Grandma, don't go to church. And she was like, we won't. Like, okay, good. I'll be good now. So I don't know.
Nice.
Yeah, it was very nice. It was like a very sweet gesture. I cried a little bit because I was like, oh, they didn't have to do that. Okay.
That's so sweet.
I know.
The nursing home stories get me. Oh my God.
Yeah. Yeah. I mean, this is like a really shitty time, but there are like lots of like really positive nuggets coming out of it, so it's good to see. Well, for the first time ever, I posted that I was going to be interviewing a nurse on the FYMI pod Instagram, and we got some like pretty good questions. So do you mind if I go through those now and ask you what our fans and followers want to know from a Chicago nurse?
Yeah, I'm so ready.
Okay. The first one was, what can we do to help nurses? Send them donuts, donate money, clap during shift change. Like, what do you need right now? Okay.
The fact that people are even offering and like having these thoughts is so nice.
Yeah.
Like it's amazing. I've seen on people's like Instagram stories and stuff in Chicago that they are doing some type of celebration at like 7 or 8 o'clock at night. I don't know what time of night it is, but it's definitely in Chicago that people have been doing some type of like balcony celebration.
That's nice.
Which it looks cool. But people have been so nice. And I've seen like people sending coffee money and like food, or like Anthony Rizzo dropped off food at a couple hospitals last week.
How do you even like logistically find out how to do that?
I don't know.
I guess question. If you like really want to, you can like contact an individual hospital, but yeah.
But at the same time, I do feel like so that type of support is always appreciated. It always is, because like these ER nurses, they're not getting breaks. They don't get to eat. The cafeteria, I think, is like mostly shut down. Yeah, so those things are like really, really, really nice. But I also just want to add like just a helpful thing, like check on your parents, check on your grandparents, the people who can't go out and get food, because ultimately, like people going to work, everything has been so nice and so supportive, but we can get food.
Yeah.
So also, yeah, check on mom, check on grandma, and yeah, I don't know, but sending like coffee and stuff like that was very nice.
Yeah.
Some friends sent me money for margaritas, which is like,
yeah, that's
so nice.
That
it's so nice.
Like more feasible. Like if you have a healthcare professional in your life, like reach out to them and see how they're doing and see if you can like do something nice for them.
And like, let's think ahead. If this gets as bad as we think it might, if we're not able to really spread this out and flatten the curve, your nurses, doctors, like anybody who works in the hospital. I know we all say nurses and doctors, but there are so many people behind this that it's a very long list. It's like easily shortened to nurses and doctors. But there are a lot of people involved in this. Get them groceries.
Like custodians and stuff. Like I didn't like, how important is that? Yeah.
One of the first things I said, I was like, they should stay home. Like we can clean up after ourselves, but they have they're good at what they do. And like everybody is needed, behind that. So, help them get groceries or medicine or whatever they might need, or see if their parents or grandparents need help.
Okay.
Because they're not able to do that.
Yeah. So. Those are good tips. Second question, do you actually want Handson masks?
Handson masks, what I've heard is that there is likely going to be a need for them. So in short, yes. Right now, I think everybody is okay on stock, but they're rationing it. They're giving like one per person per shift.
Yeah.
So it's rationed out. I think there would be a need eventually. I think it's better than nothing.
Yeah.
I don't know that it will protect against the virus. But I did watch this like long talk. I don't know if anyone has seen it, but it was an ICU doctor from New York. And he did like a little 20-minute talk, and then he did a Q&A. And he was saying, put a mask on. If it doesn't prevent the virus from like penetrating the mask, it at least prevents you from touching your face.
Yeah. Yeah.
So if you touch it and it's on your hands, you cannot touch your mouth, your nose. I mean, we can't really cover our eyes with like a Handson mask, but at the very least, it trains you to keep your hands off your face.
Yeah.
So in that sense, I think people will wear them. Like I think there will be a time and a place for them.
Yeah. So I looked into like where you can donate them. And if you just do a quick Google of like wherever you live and donate Handson masks, stuff pops up. Like I know University of Chicago is accepting some.
Okay.
So yeah, I think in short, like what you said is exactly right, that eventually it'll probably come to that because it's better than nothing. So if you like have that skill set and you want to make Handson masks, that is a great way to be of help and be like patriotic and community oriented right now. I also heard, and like I want to be careful not to spread misinformation, of course, but I heard that I feel like I don't even know if I should say this, but that soon the CDC in a couple weeks is going to recommend that people wear masks out in public, like kind of for the same reasons that you said, is that like it makes you aware of whether you touch your face or not, and like it helps. And like the only reason that they're not recommending that already is because there's a shortage for healthcare workers. So like why would regular people do that when healthcare workers don't even have enough? But like, yeah, basically just Handson masks are better than nothing. So like, why not?
That's super interesting. Yeah, I haven't heard that yet, but yeah, for the same reasons, yes, I would agree with that. Like if, I don't know, sorry.
No, it's okay.
If facilities start opening up again, are we still going to go to them but wear masks so that we don't touch a doorknob and then touch our face?
Yeah.
Maybe.
Yeah.
I think it sets like a really strange time for society. I think it just like makes things look scary.
It does.
But it is scary.
It's like, it's more of a social norm in Asian countries to wear masks and travel with masks. And it's like really not so much here, but I think that's part of the reason that they haven't done it yet already is because Americans would freak out probably if they saw everybody wearing masks, but there's no reason not to. There's no reason not to wear hand-sewn masks. Like, do save the real ones for healthcare workers, but
it's probably not hurting if you can make one at home and then you wear it when you go out.
Okay.
I also think it's like a nice thing, like you were saying, like people want to help. And like this is something that I think people can help with. So
hospitals are definitely accepting them.
I think there will be a time. I don't know if they're like publicly saying yes, we're like transitioning to hand-sewn masks yet. But they're also not saying that they never will. Yeah.
All right. Well, question number 3, did nursing school prepare you for something like this?
I would sadly, or not sadly, I don't know, but I would say no. So no, you can't, I don't know if you can be prepared for this. It's very different than like we talk about hurricanes, tornadoes, fires, like chemical spills, any emergent natural disaster. And it's like, what do you do? Or like the hospital catches on fire. What do you do? And we've been prepared for that. And there's like codes for that. And they're on our badges. Like the back of our badge has like, it'll be like code silver, black, white. I think white might actually be like snowstorm or something like that. I should have my badge with me, but we do get prepared for like emergent natural disasters. This is so different though. This is like this impending sense of doom that like you know this is coming, but you also know you don't currently have the resources to fight it. You're also asking for like an entire country to work together to not make it worse. It's very, very different than things that I feel like we talked about. But at the same time, like, I guess clinics are prepared for walking wounded or like overflow of people who don't need acute care, but they do need help. And in that sense, like we are prepared because these clinics can take on people who just need help, but they don't need a hospital bed. So we are prepared for that, I would say.
Good.
Like as an organization.
That's good. Yeah. So like risk management type stuff. Question 4. Is it true that Advil or ibuprofen has been linked to increasing the severity of COVID-19?
Yeah. So what I heard in the beginning was that it potentially is linked. And then what our system is telling us now is that this is under investigation. They're not saying it is. They're not saying it's not. I think it said early data suggests no. But in practice, people are very cautious. So in practice, they're not giving ibuprofen. So
you would give ibuprofen like to lower a fever, but like Tylenol also lowers fevers. So
like, I would just do Tylenol.
Yeah. So people aren't sure.
If you're not sure, if it were me or anybody I knew, I'd be like, just use Tylenol. Let's not risk it.
Because why not? Like, exactly. So,
and I'm not speaking from like research based. I didn't collect data. Like, I don't have an answer to that, but I wouldn't risk it.
If it makes you feel better, I asked my doctor about it, like not because I have any symptoms or anything, just because I was curious. And, she basically said the same thing, that like it's probably fine, but like why risk it? So just take Tylenol if you're trying to reduce your fever or have aches and pains or whatever. So
and you can take up to 4,000 milligrams of Tylenol a day, which is a lot. If you like, you have to
not at the same time.
Not at the same not at the same time. 1,000 at the same time.
Okay.
But up to 4 times a day, which you'd have to try to take that much. Like you'd have to be awake for all those hours and stuff. So I think Tylenol will do the job.
Okay. Good answer. All right. This is the hardest question that we got asked. It was a good question, but it is hard to answer. How scared should we be? With an answer grounded in statistics and science, please. I wrote an answer for this too. Do you want to go first or do you want to listen to mine first?
I want to hear yours.
Okay. So I don't know how to rate how scared I am. I'm pretty fucking scared. I, like, for reference, I mean, I was younger when those other epidemics were happening, but like we've already surpassed how many cases of SARS. I mean, a long time ago, surpassed how many cases of like the original SARS, like SARS-CoV-1. So I'm scared because like up to 20% of cases might be severe enough to require some kind of hospitalization, like maybe not ventilators, but like oxygen or IV fluid or something like that. I'm scared because most coronaviruses are upper respiratory, and this one has the ability to cause lower respiratory disease. Like viral pneumonia is a scary ass thing, right? Like nobody ever wants to hear that they have viral pneumonia, right? Like it's
Yeah, it's because to clarify also, because I know you and I have some background in this, but upper respiratory is like runny nose, scratchy throat, like a light cough.
Yeah.
Something that you would probably not go to the doctor for. But the lower respiratory is like that barking cough that burns in your chest.
Yeah. Feel like you can't take a deep breath or get enough air.
Yeah. You get up to go to the bathroom and you can't fill your lungs. And you know when you can't. Like if anyone has asthma or like if anyone has sprinted down the block, like that feeling. But to have that feeling after doing nothing.
Right. Yeah. The other reason that I'm very scared, or I mean, I don't want to cause like panic. I'm taking like you have to focus on the things that you can control, but what we can't control is that there are asymptomatic and mildly symptomatic people out there who are responsible for a big part of spreading of the disease. Like I think there's estimates that like 80% of the cases are mild, which is good and bad because it's easier to spread that way. Like the original SARS was a lot more severe. So like if you had the original SARS, you were probably not walking around spreading it to people. Like you were like knocked the fuck out and you were maybe in a hospital, but you were definitely not walking around. So yeah, people who got sick were like debilitated. They weren't out and about. Ebola was much harder to transmit. So this is just like a pretty shitty combination of factors. It just makes it so that it is both a serious disease in a lot of people, but not so many people that like it's not easily spread. So like the amount of people that you spread it to is higher. Like Ebola was really hard to transmit. I was never, like I said, we were younger then, but like I was never panicked about the original SARS or Ebola or really even like H1N1. But obviously this is more serious than that because we've never had to cancel entire sports seasons or move all schooling to online or, you know, these measures are being taken for a reason. So yeah, I'm pretty scared. So between all of that and then also the fact that like Trump has been incompetent in his response, like makes me really scared. Like we appear to be doing a slightly worse job than Italy in flattening the curve. And they had a mortality rate closer to 9% because not everybody who needed a ventilator could get one. And almost everybody who does need a ventilator that doesn't get one dies. So like if we, and it, I mean, I looked at those updated numbers today. Like our trajectory is still the worst country. Like we have responded the worst to it. So
why? Like Is it is it a leadership issue? Is there something else we're missing?
So I
I
good
know.
question. I think a lot
Why?
of the answers to that are in um if you haven't listened yet to the interview, the like first COVID update, it was with an emergency preparedness coordinator that I used to work with, and he did a really excellent job of explaining like what a competent response to this emergency would look like. But like once there was community spread in our country, which there was as far back as definitely February,
Yeah,
but
definitely
like
February.
we should have known that we needed a shit ton of tests. And the CDC offered our country tests and they turned them down because all Trump cares about is profit. So he wanted private corporations to make their own tests so that like his buddies could profit off of it. So the CDC here did make a test in February. It was faulty, so we like lost a week there. We lost some time because we didn't accept the World Health Organization's test. And then also all Trump thinks about is himself. So he wanted the numbers to be low. Like he doesn't think ahead. He doesn't think about like consequences to his actions or anything like that. So he just downplayed the threat, and Fox News is a propaganda machine. So they didn't, I don't know, they said the same thing, that it wasn't a big deal until it was too big of a deal. And by that time you can't like take it back. So there's a lot of like really fucked up reasons for why, I mean, there's a lot of stuff to fix. If there wasn't a lot of stuff to fix, I wouldn't have bothered to create this podcast. But yeah, so there's, I don't know, there's a whole bunch of reasons, but
Like one of the things he said that got me the worst, like he can spew out numbers and like statistics and it things that would be very hard to look up or like validate, right?
mm-hmm.
Like he can say whatever he wants to say, but he said like in one of his talks that the American people need hope. And it's like, we're dying. We don't need hope. Like we just need to know how to stop our moms and dads and our grandparents and our sisters and our brothers and like little kids. Cause like, it's not, sorry. Initially it was like, oh, if you're over 60 or over 70, you're high risk, but maybe you're more likely to be at risk, but there are young people dying.
Oh yeah, for
true.
Sure.
That's fact. Like it's whatever. It's not discriminating. So I don't, ever since he said that, I don't believe anything he says.
Yeah. I seriously recommend not watching his press conferences.
I watched it today.
Yeah. So if you are going to watch his press conferences, like Anthony Fauci is a scientist who you can listen to. But even like Dr. Birx is becoming like less and less credible. So yeah, I would recommend like not watching those briefings. Governor Cuomo from New York has really good briefings, daily briefings that are much closer to what like an actual press briefing during a pandemic response should look like. So he provides like actual transparent information, and that's what people need. Like people feel panicked because we're not getting information. It's a biological response. So I would recommend listening to Andrew Cuomo's if you are feeling like you need more information. Don't watch Trump's press briefings. He's a narcissist and an asshole. So
yeah, I will say that he did. Okay, so we all know he was like Easter, let's open back up by Easter, which is in 2 weeks, I think. And like, thank God, at least the bubble that I live in, nobody was abiding by that. No one was like, oh yeah, like I'm gonna go out on Easter. So thank God for that. But there's definitely like a good 50% of the country who is listening to everything he says and following it. So he did say today that, oh God, according to him, Easter was an aspiration. He has now kind of retracted that and said it will be the end of April.
Yeah, I saw that too. He moved it to like
aspiration,
which is also like, okay, all right, buddy.
Probably not. But
but at least he gave up on the Easter thing.
Yeah, and like tell people what it is. Like you're gonna stay home. You're gonna work from home. Get
Yeah.
used to it.
What I keep telling people, or what I keep mentioning, is we can't return to normal life until you can test people, until there's a vaccine, or at least you can tell like who has had the disease before and you can test for those antibodies. And there won't be a vaccine for a year to a year and a half. Like a year would be so fast. Like that is just not how vaccines work. And like you can't rush that because right now they're doing tests in people, and you can't just inject entire populations of people with an untested vaccine. So they're doing trials, which are really important. They're doing human trials. They even skipped the animal trials, which is like dangerous, but they're trying to like speed this process along as much as possible. But there's only so much that you can do. So, yeah, I think our lives will be severely disrupted for,
Wow.
yeah, at least a year.
Yeah.
We may have like periods of returning to somewhat normalcy, but that will also probably come with a resurgence of COVID-19. And then we'll probably have to go back to some measures of isolating. So I think the
Like
sooner people accept that, like the better. Just have like reasonable expectations. Sorry, what were you going to say? What? You look
uh,
sad. Did I make you
I
sad?
am sad.
I
I am
know.
sad.
I'm
I'm
sorry.
sad. I There were two weddings that we were supposed to go to in May that have
Mm-hmm.
been like canceled, postponed,
Yeah.
however you want to say it. They will be celebrated later.
Mm-hmm.
But like I am sad. Like
Yeah.
that's May, and it's the end of March, but it is March. So we're already looking at May. Um, as like other people have mentioned, there's no sports. Like things are very different, and then the like medicine is going to change. Like just it's going to change. Things
Yeah.
are going to be handled very differently. Um, but I'm like sad to look forward into like the fall. Like
Yeah.
we all thought like this would be over in a couple months, but I'm not convinced.
Yeah.
It was sad.
Yeah.
Like it's it's March. We're past the holidays, right? Everybody talks about like November, December as being like the holiday season. So luckily we're past that, but imagine this happening at that time of year when
Yeah.
it's like that's supposed to be your happy time, your family time, and that might not be the same next year at the end of this 2020.
Yeah.
It still might be small groups or select groups that can get together.
Yeah. But even I think about that, but like even for us with like people who have having immunocompromised people in our family, like I don't know if at any point we're going to be able to. I mean, like even if the CDC recommendations change to say like you can gather in groups of 10 or whatever, like I don't think I would feel comfortable with
Yeah.
my mom in that situation. I don't think I would bring her to it. I mean, I'm not the boss of her, so like it would be up to her, but
Can I ask, like, how is she feeling? Like, what's
yeah.
her take on this?
She's doing okay. She wants she's like talking about like we were supposed to go to Florida. She was really looking forward to it. And right when like quarantine started is we were going to go for her birthday actually, which was March 22nd. And like on the 19th or something is when we decided that it just is not a practical thing to do. And I think she was really looking forward to it, and she's sad, and she was talking about like when we could possibly like reschedule it to, and I was like it's like too soon to even guess that. So but like truthfully her life is not that different. She I mean, this is a bummer, but she's in a lot of pain all the time, and she only has use of one of her arms, so she spends a lot of time inside anyway, and in like positions that her shoulder is comfortable in. So it's I don't know. I feel more anxious for like myself and my stepdad I feel really anxious for her too. She has to go to the hospital on Wednesday for an infusion. Like, they've taken a lot of precautions. Like, chemo patients have their own elevator bank now that goes straight up to the infusion floor. They're not letting visitors come in. She has an N95 mask, so she will be able to wear that. But yeah, I don't know. We've canceled all her other doctor's appointments. We're trying to find a way to schedule. She gets Botox injections into her shoulder that are supposed to help. We're trying to find a way to like reschedule that. But so like mentally she's doing well. I think me and Jay are really nervous about, like, we have to be extra careful because we share a house with her and there's only one bathroom. So like I don't know. We just have to make sure that we don't get it either. So, but yeah, we're all doing all right mentally and physically, I guess. Yeah, but thanks for asking.
For what it's worth, I think anybody she would encounter getting her infusion is trying just as hard
Yeah.
as they can. Like, I mean, maybe not like you, because they do still have to go just like out sometimes.
Yeah.
Which, I mean, I know you still also have to go out sometimes, but they're trying.
Yeah.
I promise.
Yeah.
They're trying as hard as they can.
Yeah, I believe that. All of her chemo nurses especially have been great.
Yeah, so. It's like not something that anyone takes lightly.
Right, yeah.
On the other end, right. They could be out doing whatever they want, but I would feel confident, like, knowing where she goes. I feel pretty confident.
Yeah, me too.
That they're trying.
So, yeah. All right. Was there anything you wanted to add to your answer about how scared we should be or how scared you are?
I do have my own little thing.
Go for it.
Just trying to put numbers into perspective. Mm-hmm. Well, first of all, medicine is very confusing. Machines are confusing. Like, these words get thrown around that most people never hear this word in their life. But ventilators are the machine that fills someone's lungs with oxygen. Like, I know Sam went over all of this a lot too in a previous one.
No, go for it.
But yeah, those are the machines breathing for someone when their lungs cannot breathe for themselves. Mm-hmm. They are reusable,
right?
Which is like really, 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 really important for people to understand.
They're reusable, like hospital beds are reusable. So like when somebody's using it, obviously it's not available, but once they get better or die.
Once they don't need it.
Yeah. Somebody else can use it. It gets sanitized and somebody else can use it, right?
Yes. Okay. There are pieces of it that are not reused, but I haven't heard of any shortage of those pieces of the ventilator. So if people are questioning or wondering or confused, like, aren't we going to run out? We are going to run out of functional ventilators at a given time. Mm-hmm. And that's what flatten the curve is. It's like, yes, until we get a vaccine or a cure, which I don't even know if that's like a thing, a treatment of some sort. Yeah. Sorry, you can speak to that.
It's highly unlikely. It's really understudied because most coronaviruses are just not that big of a deal. Like most of them cause like minor upper respiratory tract infections or like some gastrointestinal problems, but like so there's just not a lot of like studies about a cure for that. But even like the regular flu, like Tamiflu is not even that effective, right? That antiviral.
True. Yeah.
So I think we're stuck waiting for a vaccine.
Yeah, Phil would speak for hours on Tamiflu and how, like, in a nutshell, you have to start it right away, and then at best it like shortens your symptoms by 12 hours. So that's
Phil is not a Tamiflu stan.
No. I mean, with like all viruses, it's just like, it sucks.
Yes.
But you have to just give it time and support. And support is like, eat what you can, drink as much as you can, stay home, and like take Tylenol, like try to keep your fevers down. Yeah. But so I guess what I'm trying to say is, will whatever percent. What did we say? Like 80% of people will get it? Is that what we were thinking?
The numbers I've seen have been 30 to 70% of the population will be exposed or will get it or something like that. Damn, I should really know. I'll look it up. You keep talking. I'll look it up.
Okay. Well, I'm a big fan of always picking the worst case scenario. Right now, I mean, like, prepare, hope for the best, prepare for the worst.
Sure, that's a good, yeah.
So 70% of the U.S. population, like, we'll think small here, we'll just think about America. 70% will they get it? Maybe, but if you get it over the span of a year, then you can be safely treated and have the resources you need, because, like, obviously, worst case scenario, again, is you need a ventilator. And will that be there for you? No. If 70% of America gets sick tomorrow, then a ventilator is not going to be there for you. But if you all get sick over the next year because people did proper distancing, proper hand washing, like, if you do everything you can to spread this out over time, then treatment, there's more treatment options. So I got 20% from somewhere. Did we think 20% was predicted to be hospitalized?
Yeah, 20%. Well, 20% of cases are severe enough for that they require hospitalization.
Okay. So let's say, and I know this is true, we have about 330 million people in America. Yeah. So I'm going to do this math right now. So if you have 330 million people, and let's say 70% get infected. No, let's say the low end was 40%. 30%. Okay, 30% get infected. And of that, 20% need hospitalization. And of that, let's say 5% need a ventilator. That's 990,000 people who need a ventilator. And we think we have 200,000. And that's pulling from storage. That's what I read today.
That's
like
Strategic National Stockpile?
Yes, okay. That one. So those are like old vents that they did say they tested them and like they will work and they'll be fine.
Good.
So that's a fifth. So we have a fifth of what we need if everyone got sick now. So yeah, my point was.
Wait, so how many ventilators are there in the United States?
Today what I read was roughly 200,000, but I've heard a lot of people quote less than that.
Okay, I see.
So I'm trying to come up with like the worst possible situation.
Yeah,
I guess, or maybe I'm not. I don't know. Did I do that wrong? I'm trying to say if the least amount of people get sick that we think will get sick, then that's 990,000. And then if we have the most ventilators that we could possibly think we have, that's still only a fifth of what we would need.
Yeah.
So we're just trying to take the most extreme approach.
Yeah.
But I think that more people will get sick and need them. And I think that we have less ventilators at hand. So I think that my number is very conservative. Right. But I do want to add that I've seen 3M, Dyson, Ford, and Tesla have been working to create ventilators, which, like, thank God.
Good.
Because we're watching this in slow motion. We have plenty of warning. We've known about this since February. So there's no reason that like these brilliant minds and brilliant people, and they have all this money and all this space, like there's no reason that they're not making things to help. So that was my like tell me something good of the weekend. I was very happy to see that some companies are stepping up.
Yeah. The thing I was happy to learn is that Trump invoked the Defense Production Act and is actually asking or requiring that companies stop making whatever and start prioritizing.
Awesome.
Yeah. I mean, it's, better late than never. It should have happened earlier, but yeah, it's within his power to require manufacturers to make stuff like that because we're basically facing a war. It's just a war against a virus.
Invisible enemy.
Yeah. But yeah, so yeah, that's good. I mentioned this on the last episode with Morgan, but the way I think about it is like if you were in charge of hosting a potluck, like you would tell people what to bring. You wouldn't be like, all right, guys, come on over. Like party's at 7. And then like everybody brought fucking lasagna. It's like, wait, I wanted something to drink. I wanted a dessert. Like, yeah. So tell Trojan to make gloves and tell 3M to make ventilator, respirator, whatever. And tell Tesla to make gowns. I don't care. But like, they need direction coming from the top, and obviously we are lacking that, like morally and in every other aspect basically. But
yeah, I think I saw that New Balance and oh god, I forgot the name, but like one of the companies that makes jerseys, they're making stuff, which is awesome. And then Figs is a scrubs company. They make scrubs. They were donating scrubs last time I saw, but they've been vocal. Like they're small, like they're a much smaller company. They probably don't have the ability to do much more. But yeah, people are trying.
Yeah, banding together.
Yeah.
Okay, well, let's end on like a little bit of a lighter note. What is your pettiest quarantine complaint so far?
My pettiest quarantine complaint? I really want to get my hair done.
Yeah, I get it.
Yeah.
My eyebrows are struggling. And like there's only so much I feel like I can do with tweezers. I don't like, and I've never needed a pedicure more in my life. I'm at the stage where like half of my big toe is covered, and then like there's no nail polish anywhere else, and it's just like not a good look. But
yeah,
people have real problems, but I'm like, my toes look bad.
I know. I started doing home pedicures. But...
yeah, I probably should. Maybe I'll do that tonight. That seems like a nice self-care thing.
I think the key is to soaking them. You gotta soak them. Yeah. And then you can clip them up, file them down. Yeah.
What would you do to your hair if you could go get your hair did?
I'd get it highlighted. I was low lighting it for a while to like blend my roots with blonde. And then I'm like, you know what? I'm ready. I want to go like super blonde again. So I went and got it done in January, February, something like that. And they told me, they're like, I mean, your hair is kind of dark. It's going to take, you should get it done today, and you could come back in 6 to 8 weeks and get it done again.
And you
to
were
get
like,
it blonder.
Great. I'm sure there won't be a pandemic. I'll be back.
I know. It's okay. I will be absolutely fine.
Yeah. Squeeze some lemon juice in there and sit outside for a while, I guess. I don't know.
That's the other thing. I do want to plant some plants.
That's soothing, I think.
Yeah. It is. It's super soothing. Yeah. So.
And okay, what other kind of like self-care has been helping you get through this? Anything you're doing to like treat yourself?
We have been eating out more, which is always a self-treat. And then it's also like a nice...
Support local businesses?
Yeah. So we've been trying to do that. And then we were talking about this earlier, but I'm trying to watch Tiger King.
Yes.
So, Unleash the documentary.
Yes. Everybody watch Tiger King, please.
Yeah. And then I still did spring cleaning.
Nice.
Yeah. And that feels good.
Felt good. Yeah, for sure.
So good. Yeah. And then video chats. I never used to video chat.
Right. Me neither.
Yeah. So now I've got House Party, Zoom, and then FaceTime.
Yeah. Which I think we have done all three in the last like 3 days.
Yeah.
But yeah, it's been nice. We've been video chatting with our high school friends, and it's been like wonderful. And all of us are like, why didn't we do this before? Like, so that will probably be like a silver lining of quarantine, is like,
and like my grandma has FaceTime, like she has an iPad, so she can FaceTime, and then she learned, I guess she was doing Facebook Messenger video.
That's impressive.
Yeah, like everybody's coming together.
Yeah, good. Good. I
mhm.
I went on a really nice long bike ride that I felt much better afterwards. It's been a little like cold and rainy since then. I can't wait for like the weather to be nicer so I can go do that again, but that was definitely nice. And then honestly, I don't know why I didn't think of this, but like until you mentioned that you can give yourself a pedicure, I just was like, I guess I just live with this now. But no, I have agency. I can paint my own toenails. I might do that tonight.
Yeah. Yeah, it's not the same, of course, but
No, but I'm going to try.
yeah. And then I do also have a nephew on the way.
Yeah. Actually,
EBB
I am
to be
not
born.
sure if I knew it was a boy.
Yeah, it's a boy. It sounds like my sister is going to the hospital Wednesday, and then they'll see like how far along she is. So
Okay.
he'll be born Wednesday or Thursday.
And they live in New York.
They do. And I checked in today. So as of today, I think the governor said a laboring mother, like by law, she can have one chosen loved one in the
Good.
room, one
So,
partner.
Good.
Yeah, but they can't leave once they get there. So like Jonas can go, but he cannot
What is
leave.
that noise?
Phil, sorry.
No, it's okay.
Can you hear her?
No.
Oh.
I'm sorry for doing the podcast. I was just trying to clean up.
No,
Oh,
it's okay.
he can't hear you, but he like as soon as you said that, he gave me like the thumbs up.
I'm sorry. I was just trying to clean.
He's
No,
taking
it's
out,
okay.
he was putting the trash together.
Oh, gotcha. It sounded like it sounded like rapping. Not
Yeah.
rap. I don't know. All right.
It was like a brown bag
Yeah.
with trash.
Okay, gotcha. Okay, so her husband can be in the delivery room with her.
Yes, he can be in the hospital. He cannot leave the hospital once he's there, which,
Well, good. Neither can she. So that sounds fair.
but they have a 2-year-old.
Oh,
2.5.
right.
Right. I know.
What are they going to do
And-
with Emma?
So I think my sisters, so they have to like stagger this as much as they can. So Lauren's going in Wednesday, like afternoon, evening,
Mm-hmm.
and then he's not going to go with her. He'll like
Okay.
come when she's further along.
Yeah.
And then they have Juliet who's 17, so she can.
Oh my God, Juliet's 17.
I know.
What the fuck?
I know. She was 8 yesterday.
Yeah. Swear
Seems
to God.
like, yeah. So she can drive. She has a car. She can she can help
Right.
with Emma for that short period of time. But Jonas will definitely leave and come back home before Lauren.
Gotcha.
Weird times.
Weird times, but that is a nice thing to look forward to.
Yeah.
You're going to have a nephew. You don't have any nephews.
I have none. I got 2 nieces and 1 nephew on the way.
Yes, very shortly.
Yeah.
Well, that's exciting.
Yeah.
Well,
Some joy for
yes,
the week.
some stuff to look forward to. Well, thank you very, very much for answering all of our questions. And for like everything that you're doing. I mean, everybody's realizing now like how important doctors and nurses and all of that support staff is. But yeah, thank you for being like the front lines and keeping everybody else safe.
Oh yeah, everybody has a role, so yeah.
So
I will do my best to give more updates like as we go with masks. If we hear anything about the ibuprofen,
yeah,
I'll give you all the
I'd
updates.
love that. Perfect.
Yeah.
Okay. Well then we can wrap this up. You don't have to hang up, but I'm gonna end the recording.
Okay.
But yeah, thank you for joining us, and I'm sure we will be video chatting shortly.
Yes.
All right. Bye.
Bye.
Make sure you follow along on Instagram at FYMI Pod. Shout out to Hope Dye for the podcast art and Kyle Dibdahl for the intro and outro music, and Ben Schlofelt for the audio production.
Please subscribe to this podcast, and if you like it, give us a rating and review. It makes us easier for other people to find us, and the more of us there are, the better. We come out with new episodes every Monday.